AM 1490, FM 105.5, WGCH and WGCH.com anywhere. WGCH News Center time is 7:21, and time now for Happy and Healthy at Any Age with Robin Pastore.
Good morning to our listeners in Fairfield and Westchester counties, our listeners listening streaming live everywhere, Mystic, Connecticut, Boston, Austin, Houston. Please keep your text, comments, emails coming. I want to give a big shout-out to our friends at the Greenwich Historical Society. Story Barn is this Thursday night at 7 p.m. Zoom, contact them. It's great stories. This morning's guest is one of the most inspiring gentlemen you will ever meet, Dr. Andrew J. Gerber, medical doctor, Ph.D., medical school graduate from Harvard Medical School, did his residency at New York Presbyterian. His accolades, fellowships, academic affiliations, he's an associate professor at Yale. Professional memberships, board memberships are too long to list. You should check him out on LinkedIn. You will be very, very impressed. Good morning, Dr. Andrew Gerber.
Good morning, Robin. Thank you for having me on.
Thank you for joining us. So you are the president of an organization called Silver Hill Hospital. What is Silver Hill Hospital?
Silver Hill is a nonprofit private psychiatric hospital in New Canaan, Connecticut, that has been there for 90 years.
Right.
And for 90 years, we've been dedicated to serving our local community and patients and families all over the country.
And I've gotten many emails and texts in preparation for today's show about the importance of addressing mental health during this pandemic. One listener sent me an article that CNN recently wrote entitled, "Mental Health is one of the biggest pandemic issues we will face in 2021. All the reports say that substance abuse, mental health challenges have increased during this pandemic. Is that the case that you're seeing at Silver Hill if you compare, say, 2018 or 2019 to post-March 2020 and our current January 2021?
Absolutely. It's really tragic what we're seeing. It's too early to see the research studies and the aggregate numbers yet, but our experience is every day that at least half of our patients are coming in and identifying the pandemic and other things going on in this terrible year we've had in 2020 as one of the main triggers for why their mental illness and addictions are worsened this past year.
Right, and one listener sent me something that you all sent people in December, and you summed it up perfectly in your literature. A listener sent me the following email that you guys put out at Silver Hill. The anxiety, isolation, and uncertainty created by the COVID-19 pandemic have been particularly difficult for those who are vulnerable to mental health and substance abuse challenges. Now, one listener said the following. She emailed me. She said, I studied child care in Pennsylvania. I have grandkids. What is the emotional fallout of this pandemic? How is it impacting particularly older teenagers, 17, 18-year-olds, and college students? Because this is the time, she writes, where relationships, friendships are being formed, romantic relationships. How is the pandemic impacting our students?
So I think you and your listeners have come right to the point. The two biggest stressors that come out of the pandemic are the uncertainty that we all feel, but that people with vulnerabilities to mental illness and addictions, I think, feel the worst. And second, the lack of in-person social contact that is really a resilience factor for so many people. One of the things in non-COVID times that we tell people is be around other people. Do things with others. Don't just stay on screens. Don't just be on the phone or even on Zoom. Get out there and do things with people. Well, obviously that's not something we can recommend in the same way as we always did, and that makes everything so much worse.
Right, and something that you and I were talking about off-air is something that another listener texted me about the fact that when college students come home, Thanksgiving break is when they came home from states, there are many states where pot is legal, marijuana is legal. And families are facing challenges where kids are coming home saying pot is beneficial. They've been so educated by their peers in these states. On your website, you publish an article called Marijuana and Psychosis, and there's been literature that suggests that marijuana use can lead to bipolar disorder later in life, psychosis. What are your thoughts on marijuana for older teenagers and college students?
It's a great question, and it was a struggle before the pandemic, and it will be long after the pandemic is under control. So I'm glad we're talking about it. One of the problems is talking about marijuana or pot quickly gets into what people often feel is a moral discussion about good or bad. I'm going to stay away from that, but just talk very specifically about what we know from a mental health and addictions perspective from the data. What we know is that for a significant percentage, not all, but a significant percentage of young people who used marijuana, particularly the current high THC marijuana that's available, which is very different than the marijuana that was available 20, 30, or 40 years ago, that there are significant negative side effects of that marijuana, including, in some, the development of psychosis. And that is an extremely serious symptom that often, even after the pot is stopped, is very hard to get under control. We need to know more about that. We don't understand the implications of the widening legalization or decriminalization of pot in this country, but one thing we do know is that as it becomes commercialized, as larger and larger companies are making profits from the distribution of marijuana, we're going to see these rates going up nationwide, including in Connecticut, and that has unforeseen, but we anticipate negative effects on the health of our young people.
Right. Now, here's a question that was emailed to me from a teacher. Ask Dr. Gerber, because I promoted this on social media and I have e-blast to people, ask Dr. Gerber if he's observed developmental, social, other delays associated with the pandemic, and if so, in what areas for students, and is it too soon to make judgments about the effects of the pandemic on children and young people? I have observed, she writes, that some young people beginning their adult lives are sad and confused and feel powerless in ways to do what they had planned to do. What are your thoughts on the developmental social delay aspect that you may see for students?
I think it's a very astute question. I think it is too early to know for sure, but certainly anecdotally what we've seen with the young people, and we do treat adolescents from the age of 13 up, and certainly young adults at Silver Hill, what we've seen is that the uncertainty, the fact that their trajectory in school is so unpredictable right now. They don't know one day to the next whether they're going to be at home, whether they're going to be in school, when they're going to see their friends or teachers again, that's had a very negative impact, and that their relationships are just different. What they're able to do with their friends and others are different. Now, kids do adapt. Kids are phenomenally resilient in most cases. So you never want to count kids out in terms of figuring out other ways to connect. And many kids are doing okay. But it's, again, going back to your original point, the vulnerable ones, the ones who were at risk for struggling anyway, that are most negatively affected, and we think we're going to see more of that.
We have to wrap up, unfortunately. I did want to talk to you about your Center for Adolescents. You have outpatient programs for kids 18 to 22, which are fabulous, I'm told by listeners. I did want to address the elephant in the room, that you are not only for rich celebrities, you have reimbursement programs, and people can reach out at silverhillhospital.org if they have any other questions. Thank you so much for joining us, Dr. Gerber, and you have a great day.
Thanks very much, Robin. That's Happy and Healthy at Any Age with Robin Pastore. You hear her show each Tuesday morning at this time right here on AM 1490, FM 105.5, WGCH.